Atherosclerosis.
Hi, my name is Nileb and I'll be your nurse today.
I'm Judy.
So what brings you in?
I feel like an elephant is sitting on my chest.
Tell me about your symptoms.
Well, I'm tired. I have a hard time to breathe and my chest feels really tight.
And how are your eating habits?
Not really good. I go to McDonald's 3 times a week.
What about your exercise?
I don't exercise.
Do you smoke?
2 packs.
Okay, so I'm just going to check your heart rate. And breathe in. Your heart rate is beating very quickly and I'm hearing a lot of whooshing sounds. And I'm just going to check your pulse now. And your circulation. Your leg is also very cold, indicating poor circulation. And I'm just going to send you for a blood test and I'll see you back in a week.
Okay, sounds good.
Hello, doctor.
Hello.
So I have a patient and who just came to the clinic and she said that she was having trouble breathing and she explains it as having an elephant sitting on her chest. She had poor circulation in her legs and her heart was beating very fast. I had a feeling that this might be an artery disease.
Well, maybe it's atherosclerosis.
And what is that?
Right, so atherosclerosis is an artery disease. It can happen in any large to medium-sized artery in your body. Basically, it starts when the endothelium lining in any artery becomes damaged, and that exposes the smooth muscle tissue underneath. So what happens is the lining will release chemicals, and they will take these lipoprotein, or the lipids that are in the blood, and kind of turn them into low-density lipoproteins. And these are full of a lot of bad cholesterol. So basically what will happen is these lipoproteins will travel back down into this little area down here, and it's called the antima, the little area in between the smooth muscle tissue and the endothelium lining. And this will trap a lot of, cholesterol, and it will trap calcium, and it will trap, fatty substances. And over time, these will, like the lipoproteins, become oxidized. They will cause the smooth muscle tissue to be inflamed, and it will cause inflammation. Over time, the plaque will build up and build up and build up, and it will become more and more inflamed, and it will create a bulge over a period of decades. And then what can happen over decades is this bulge can actually rupture, and if it does rupture, it will again expose the smooth muscle tissue underneath. And then if that happens, then clotting will be initiated. And so if clotting is initiated, it can lead to cardiac disease or stroke.
Oh, okay. So it would affect homeostasis by forcing the heart to work harder to pump blood. It could also increase blood pressure and increase cholesterol levels in the blood, creating an imbalance. The cell membrane would be affected because of the plaque bulge pushing on the endothelium tissue. Because of the bulge, the high-density lipoproteins would not be able to transport the cholesterol. Therefore, the cholesterol would stay in the arteries.
Exactly. 1 week later.
Hi. So how are you feeling since last week that I saw
The
you?
same way. My chest feels tight and I'm having a hard time breathing and I'm really tired.
Okay, so your blood test came back and it came back positive for atherosclerosis, which indicates to us that there are high levels of cholesterol in your blood and that there's a protein in your blood that is not doing its job properly. So atherosclerosis is an artery disease that causes a plaque buildup in the medium to large sized arteries, and in your case, based on your symptoms, this disease is caused in your heart.
Okay, so what's in the plaque?
The plaque contains cholesterol, lipids, and calcium.
I still don't understand.
Okay, so this is a diagram of your artery. The arteries are in charge of delivering oxygenated blood to the rest of your body. If there's a plaque buildup in the arteries, your blood pressure would actually increase, causing your heart to work harder to pump the blood.
What did I do to cause this?
Well, many factors actually contribute to the development of the disease, such as smoking, lack of exercise, and not eating healthy.
Am I gonna die?
Not necessarily. Unfortunately, there is no cure, not yet, and the only thing that you can do is change your lifestyle, so you can start exercising more and eating a healthier diet, having a healthier diet, and reducing your smoking.
Okay, so I will make lifestyle changes.